When we're trying to differentiate rather than the stage of shock, but the etiology of shock. So what exactly is causing the situation for the animal to have gotten in that situation? So we're looking for an ideal cause. Now we usually use our history and our physical exam to help us identify that, and we're generally breaking it down into 4 categories. Hypovolemic, meaning they've lost volume, maybe through vomiting or diarrhea, something like that. Hemorrhagic is a subset of hypovolemic shock. Another etiology is cardiogenic shock. We have a problem with the heart acting as a pump, so it's not directing the blood in the way or in the amount that it should. The third stage is generally, there's multiple names for it, or the third etiology, there's multiple names for it. Sometimes it's called septic shock, or distributive shock, or vasogenic shock. And in that situation, all of the blood vessels, arteries, veins, or both, are systemically dilated. And so the fluid is there, it's just that the tank has gotten a whole lot bigger, whether that's arteries, veins, or both, even down at the capillary level a little bit. And then the last stage, or the last etiology, which some people like the characterization of it and some people don't, called obstructive shock. So again, our heart is fine, there's enough fluid in the vessels are okay, but the blood can't get to where it needs to go. And we think about that with maybe a pericardial effusion. So the heart itself is fine, but it's being compressed by the fluid around it. Or a GDV is an example where they might get all of the stages or all of the etiologies of shock. They can have arrhythmias causing cardiogenic, systemic inflammation causing that vasogenic or distributive shock. Sometimes they can get obstruction because of the compression of the stomach, and then if they have a systemic inflammatory response, they can have that final stage of shock as well.